You're listening to The Physician's Mind, raw stories and real talks with people who are striving for greatness in medicine and in life. This is where ambition meets action and where the relentless come to level up. I'm your host, Curtis Wilkerson. Thank you so much for tuning in. Let's get right into it. All right, everybody. Thank you for tuning into this episode of the Physician's Mind podcast. I'm your host, Curtis Wilkerson, and today I'm joined by Dr. Jamil Haddad. Jamil is a first-year orthopedic surgery resident at McLaren-Macomb in Michigan, and he's a graduate of the Michigan State University College of Osteopathic Medicine. Jamil, how are you doing today, my friend?
I'm wonderful, thank you. Very happy to be joining you once again, Curtis, and I look forward to answering any questions to help steer any medical students like yourself that are interested in orthopedics or medical school and excelling in that and residency in general.
Absolutely. So today, Dr. Haddad and I are going to discuss the successful transition from medical school graduation into residency. If you're interested in hearing Haddad's insight on how to succeed in medical school, I will put the link to a previous episode of ours in the show notes. But today, Dr. Haddad, we're going to go ahead and get right into it here with the first question. So what was the biggest mental shift that you had to make going from being a medical student to a surgical resident?
Yeah, great question. So as a medical student, everything that you do, everything that you say, it's all checked, it's all vetted by other residents and attendings. They double check, they make sure that what you're saying and doing is accurate. They make sure that your physical exam maneuvers are good, your history taking is thorough and accurate, and any assessment and plans you have for the patients are appropriate, indicated, and evidence-based. As a resident, while you do still have some oversight with more senior residents and attendings, there's a far greater degree of independence that you have yourself in terms of patient care and creating a differential diagnosis and obtaining a thorough enough history where you truly understand and know the patient and know kind of what your diagnosis could be, whether they need operative management or non-operative management, and what is the management for whatever condition that they're presenting with. Because all the patient knows and all they can explain for you is what hurts, why it hurts, and how it came to hurt. And then you have to figure out exactly what could be the cause. Is it more of an acute thing? Is it a chronic insidious process that's been occurring? What are some of the risk factors they have for whatever diagnosis that you may suspect, and everything like that. So the transition from medical school to residency, my medical school time as a clerkship during third and fourth year, rotating at the hospital, it was a wonderful time where I learned a lot, worked with a lot of very educated and very talented young residents, both medical residents and surgical residents, that taught me how to have very good practical and hands-on skills and how I could practice at home, as well as have that very good differential diagnosis mind to learn to, kind of cast very specific nets into the water to figure out kind of what's going on and how to progress and figure things out. So residency is just far more independent. There's less oversight, and you have a lot more. It's much more rewarding at the end of the day, but it's also a higher degree of stress and factors to consider that may weigh on somebody's mental health or other struggles that people may have.
Okay, interesting. So one of the biggest things that you noticed, one of the biggest shifts you had to make in that transition was that there is a higher degree of responsibility and a lot more independence versus when you're a medical student.
Yeah, certainly. The transition is very abrupt for some residencies. With July 1st of their first year of residency, they kind of get thrown into the deep end of the water. They get handed a pager like this guy, and they get told, go crazy, and good luck, just call me if you need me, or run through things with me and then over the phone and then do what you need to do. Whereas other residencies, they kind of more so take you by the hand and slowly ease you into it. But one way or the other, by the end of your intern year, all residents theoretically should be well competent enough to be able to see and manage and figure out problems and everything with patients going on and treating them very well to progress on to second year and the rest of the residency.
Absolutely. And you're nearing the end of your first year of residency, approaching the second year, so you've had some time to live through the experience. Now, that being said, is there anything that you wish you had done differently between match day and the beginning of residency to have been a little more prepared?
Yeah, great question. So what I didn't realize is I set up international medical rotation through some of the nonprofit organizations in my home country of Jordan to be able to go there and volunteer with refugees from neighboring countries, including Palestinians, Syrians, Iraqis, and Egyptians that were coming to Jordan, which is a very open bordered country that allows them to come and kind of obtain paychecks and transitioning them to jobs and becoming local citizens that contribute to the economy and everything like that. But the neighboring impoverished and war-stricken countries, it's very tough for a lot of them to be able to provide for themselves. So a lot of them have very limited economic and social backings. So when they come to Jordan, has a great need for medical missions. So going on a medical mission trip there was a very exciting and very insightful time where I got to see how doctors operate in developing countries with very limited resources and kind of figure things out and go about things in a very cost effective manner while treating patients empathetically and thoroughly as well. So I did that for about 4 weeks. Retrospectively, I wish I did it more broadly and more in different countries as well. That was definitely one of the highlights. That was right before matching. That was my last rotation before matching. After matching, I wish I actually went back to a different country. I'm fluent in Arabic and Spanish, so maybe this time to a Spanish country, similar to what I did with a rotation my second year of medical school. Going to Merida, Mexico with my school and doing some clinical rotations there. Just because I have a heart for international medical trips and operations, as well as for local medical trips and helping people on the streets, volunteering with a really awesome organizations such as Macomb County Street Medicine that provides health care and wound care and medical advice to people who experience homelessness and substance abuse and counseling them and providing them rehabilitation resources and other advice. As a medical student, that was a very impactful thing for me that unfortunately I'm just not able to participate in as much as a resident now because because the schedule is so kind of stringent in addition to the responsibilities outside of work also requiring a great deal of time. But doing some more service organizations and stuff like that during the time, I think would have been very helpful for me and enjoyable for me as well.
Absolutely. So doing something, whether it's a service related activity, some sort of travel, just something to really enjoy those periods of free time that you have before starting is something worth considering.
Yeah, certainly. It's an international medical rotation. A lot of people, some people go with the kind of impression that this is going to be a vacation, a piece of cake, really enjoyable, going to get to see the world. Going there with that kind of mentality is completely erroneous and inappropriate. You know, you have to really have a heart to serve the underserved, to serve the less fortunate, to truly see other people as the way that God created them. Every single individual valuable with the life that they have, regardless of if they have a different culture than you, they speak a different language, they have a different religion. All of that stuff is irrespective of the fact that we all ought to treat one another with human dignity and decency, regardless of who we're providing care for.
Absolutely. I agree with you 100%, my friend. During your first month of residency, was there anything that caught you off guard despite all of your preparation?
Yeah, so the first month of residency in July, it's a very big time for a lot of graduation events and birthday parties. And for me, several weddings. Several of my best friends are getting married that month. But being on the intensive care unit rotation that was scheduled for me in July, it was actually impossible to request any vacation time off. But fortunately, one of the other interns on the service was very gracious, and we did a couple trades that worked out where I was able to go to most very important life events for myself and my friends that I wanted to attend. While that did come at great expense of sleep deprivation, going to a wedding the night before and then having to be at the hospital the next day at 5:30 a.m. quite regularly. Just getting to be able to like leave those events a little bit early and catch up on some sleep. You didn't really miss out on too much, but the work life balance aspect of residency kind of came down hard July 1st. It's very rotation specific, but in general, surgical residencies are more time constrictive and expectant on demands of time obligations to the hospital and picking up call shifts and covering surgeries and everything like that. So it's very important to kind of keep that in mind as you do navigate through the waters of selecting a residency, but also follow what you love and do what you enjoy. I very quickly came to love orthopedic surgery through numerous shadowing opportunities in their clinics, in the emergency room with consults, and in the operative theaters. And through innumerable experiences, I really only had positive experiences, and I fell in love with the musculoskeletal system and studying it and figuring out pathologies and clinical implications and long-term prognoses and ways that we can maximize and help benefit patients in the best way possible by treating them with the most evidence-based medicine studies and surgical kind of techniques that are out there.
Most definitely. Now, how did things change for you when you transitioned from Jamil to Dr. Haddad, from student status to doctor status?
Yeah, great question. Definitely for the first few weeks, it was tough walking into a patient room and saying, "Hello, my name is medical student," and then I would pause and very quickly remember. It definitely required a moment of silence, a moment of gratitude, where I very oftentimes had to sit and be thankful for the position I was in and remind myself that my Lord Jesus Christ has brought me to this point, and for that I am eternally grateful. And I would always remember that and not grow hardened, not grow angry at my patients that may not understand or that may be that I may have a different perception of them compared to the proper perception that they need help and they might not be educated on a certain topic. Patients might require a little bit more time and a little bit more hand holding to receive the appropriate care and treatment they need. So the transition overall was a very slow process. When you're a medical student, you rely on kind of pushing the plate over to, oh, I'm just a medical student. Let me ask the doctor. But when you become a resident, you become the doctor and you kind of help navigate the waters of patient care and patient management. So it's very important to view each patient with the utmost respect and care so that you can kind of help your patients to the utmost degree.
Absolutely. Absolutely. Now, were there any sort of habits or systems that you implemented to help you stay organized during the first few months of chaos?
Phenomenal, phenomenal question. So, a huge thing that I did is I have various educational documents, educational note sections in my iPhone, and I have various, notebooks. And in each of those, depending on what I've learned, what I've been asked, what I don't know, I write down each specific thing, and I'll go home and I'll read about it. I'll look up the research and the literature on the subject. I'll open up a certain medical book on the subject and read through it, and then I'll take notes on it, and then I'll review the notes a week, a month, a couple weeks later, whenever is most appropriate, so that I continue to memorize and consolidate the information that I've learned. Not so it kind of comes in one ear and out the other, learning something very important or very high yield and forgetting about it a month later because I didn't have the time to write it down in my notes, or I didn't have the time to go read about it and save a couple documents that I can kind of review at a later time. So it's very important to be very, very organized with that. Another thing is the schedule. So having a very good either Google Calendar schedule or iPhone calendar schedule. Some people like to write out their planners. And as soon as you schedule a meeting, an orientation in the beginning, a call shift, whatever it is, write it down, plan it out. And anytime you need to make another meeting, another appointment, anything at all, go back to the kind of master sheet and look at your schedule. So having that kind of systemic organization is very important to not miss meetings, to not miss alarm clocks, to wake up on time, and always having a backup plan in case, like, if you lose your electric or your digital copy, what happens? If you lose your paper or your written copy, what happens? So always backing up one with the other, and vice versa as well. And to avoid missing like alarm clocks, like I know people that rely on digital clocks that they plug into the wall. What happens if the electricity goes off one night? Are you just going to miss your ICU call shift the next day? That's not possible. So make sure your phone is plugged in and you have a digital alarm. Make sure there's several different types of barriers in place. Something we call in medicine the Swiss cheese model. So if you have several layers of Swiss cheese with the big holes in it, object can only fall through several layers of Swiss cheese if it lines up with a hole in the Swiss cheese slice of each slice. So to maximize how many things you miss, or to minimize how many things you miss, to maximize how many things get caught and you figure them out and you come to the solution, you got to put more layers in place, set up kind of barriers and boundaries, and set up different types of methods and use backup systems and everything like that to prevent anything from happening.
Nice. Okay, I like that. So taking notes of things that you're not certain on, but don't quite have the time to look up right in that moment, and then referring back to it once you have a little bit of downtime at home, and then checking in a few weeks or a month or so later to really reinforce that knowledge, and then keeping a nice schedule so you don't miss call shifts, so you don't miss alarm clocks or meetings. And the Swiss cheese method, add those layers of cheese, baby, and that way you'll succeed. Was there anything that medical school didn't prepare you for that you had to learn quickly on the job?
Great question. So, fortunately, medical school does a really good job of preparing you to be a constant learner, to continually read the books on the subject, to read the newest literature that's coming out on it, to review the evidence-based medicine, to review the highest yielding websites and resources with applications on your phone and links and everything like that that you can to access and assess the most appropriate management, either the surgical or the medical management for any problem or any type of patient that you may experience and encounter. So fortunately, I already had a lot of apps already lined up in terms of for medical management, for medication dosages, for frequencies, for different types of surgical managements versus non-operative, non-surgical managements on various types of problems, learning the different types of adverse outcomes, and having that thorough discussion to talk about the risks and benefits of every different type of procedure and every different type of medical treatment, or the avoiding medical treatment, what happens, avoiding surgical treatment, what happens, and having that thorough discussion with each patient is something that I learned towards the end of medical school, but more so on residency. You know, you talk to the patients and you realize the patient only knows what you tell them. So if you forget to tell them about a certain type of complication that could happen after a surgery and it happens, now they're going to be very, very upset. The risk of litigation and public litany goes up tremendously. So it's very important to be thorough, to truly understand whatever type of surgery that they're going to proceed with, or what other type of medications that you're going to prescribe them, to talk about different types of adverse effects, the complications, the adverse profile, everything like that. So patients know this is a possible risk. This is what I'm going to look out for. This is what I'm going to do if it happens. And this is the management about this complication if it occurs. And having those thorough discussions with patients was something I saw a lot of really good residents do as a medical student. But in residency, I realized I am that resident now. So if I don't have those conversations with the patients and the attending assumes that I did, they proceed with a surgical treatment or a medical treatment, and they don't know about this possible complication occurring, they might just brush it off, forget about it, and really catastrophic outcomes can happen. So it's very important to have that thorough discussion with patients.
I agree, and that requires you to have an immense breadth and depth of knowledge so that you can adequately explain the things to the patient and know the most pertinent pieces of information that they should know.
Certainly. And to do that, that requires constant daily studying. You don't have to go home and study for 5, 6 hours a day, but you should go home and review higher yielding subjects that you encountered through the day, whether you saw a couple diabetic patients or CHF patients or COPD patients. Go home, read about that stuff. Go back the next day and treat your patients with, the best treatment out there with in a cost effective manner, whether patient needs this treatment or this treatment, whether you should talk about these complications or these ones, and everything like that. So it's very
Absolutely.
important to continually learning, at least for an hour or so every day, just to continue kind of maintaining and being a lifelong learner that you promise to be as a medical student, which will continue as a resident, a fellow, and especially an attending.
On the topic of learning, how did you approach learning in a rapid environment like the operating room when everything could feel so unfamiliar and fast paced? And what would you recommend for
Great
a
question.
incoming resident?
Yeah, for medical students, the most important thing is to be an observer. And as soon as you're done observing, as soon as you walk out of a surgical case, if you're not walking immediately into another one, if you have a couple-minute bathroom break or you have a second to get some food, write down everything you learned. Write down how the patient was positioned, how the prepping and the draping occurred, how the surgical technique and the marking occurred. What were the surgical planes, the intermuscular and the internervous planes? What adverse structures and things are at risk? What possible postoperative complications can occur? What different types of surgical techniques and tricks was the attending trying to teach the resident, or the attending trying to show you? Write all that stuff down, because if you don't, it will be lost in the wind. You'll forget it. It's very important. And then as an attending, you'll go, oh my gosh, what was that one thing my other attending used to say? Oh, I don't know. But if you have it written down and well documented, now you can refer back to tibial plateau fractures. Let me open up what Dr. So and so said about the surgical technique for reducing them and then fixing them, and so on and so forth. So be an observer, watch, listen, learn. Try to stay out of the way, watch a few times. Once you get the hang of it, you can get your hands a little bit dirty and try to help out in any surgical technique and in positioning and draping and prepping. It's okay to ask for help. Ask the scrub techs for help. Ask the industrial representatives for help from Stryker, Arthrex, Mytech, Johnson and Johnson, DePuy. Ask them questions about the types of implants they have, or the surgical techniques, or the procedure, whatever it is. Have that conversation with them so that you maximize learning in every moment.
What is the best way to earn trust and respect from attendings and other senior residents early on?
To do the simple things right. If you're not practicing your simple interrupted suturing, or your running suturing, or subcutaneous suturing at home with cadaveric pick feet, or with taped up shoe boxes that you cut with duct tape, and you're practicing your stitching with different types of suture pads and everything like that, then when you're going to be suturing, one day the attending is going to watch you, and they're going to go, "You move awfully slow," or they're going to go, "You're doing this wrong. Have you not been practicing?" And when you break trust out over little things, there's a very, very low likelihood that they'll trust you with big things. Jesus said, "He who is trusted with a little will be trusted with a lot." So when you're reliable, when you're faithful, when you're thorough with the little things, then slowly over time you're going to have increasing responsibilities, roles, obligations, and trust established. First impressions last, they matter. So very, very important to hit the ground running, to make sure that you don't start, walking too slow in the beginning. And to do that, you just have to be studying. You have to have really good surgical techniques and practicing everything at home. We're devoting our lives to patient care and to making sure that patients are treated the best that they can with the abilities that God has given us. So we have to maximize our ability through continued learning at home with surgical techniques and studying, in addition to in the hospital, being observant, taking notes, reviewing those notes, everything like that.
Were there any mistakes that you made early on that taught you some valuable lessons about how to succeed in this environment?
Yeah, certainly, certainly. Like getting a call to come to the emergency room for right hand pain, or for an abscess over the right hand in a patient who may use IV drugs, and not doing a thorough examination on all extremities. Asking the patient, "Do you have any other complaints? Is anything else going on?" They can very easily say no and forget to mention X, Y, and Z. But a patient with a right upper extremity abscess might also have one in the left upper extremity and the left foot, so on and so forth. So it's very important to be able to be very thorough and kind of talk about everything like that. Essentially, a lot of the early mistakes that myself and many of my co-residents committed was assuming that we kind of know more than senior residents and attendings that have gone through the same periods, have done the same procedures, have seen the same types of patients, and have a wider list of like a differential diagnosis and considerations and clinical implications and everything like that when we see patients. So we get afraid to ask for help. We get scared to ask for guidance. We get shy to ask for what type of resources and other things that we can use and read about at home when we go home from the hospital, to continue to grow the breadth and the depth of our knowledge on various subjects. So it's okay to ask for help. It's okay to sit down and ask for good resources that they recommend reading from. It's okay to let your senior residents and attendings know you don't understand something. It's far better to be perceived as not knowing a certain subject, and then get educated on it, and then become a professional or very understanding of that subject, rather than faking it and pretending like you understand the subject. Meanwhile, patients get harmed because you misdiagnose them, or you mistreat them, or you give them the wrong medications, or the wrong surgical considerations, all because you were uneducated on a subject that you were too shy to ask about. So find your areas of weaknesses and don't be afraid, or don't be shy to ask.
Great piece of advice. Yeah, never be afraid to ask questions, because I'd imagine in your case, you can never ask too many.
Correct. Yeah.
How did you manage the fatigue, the stress, and the physical exhaustion that comes along with a demanding surgical schedule?
Yeah, great question. So the fatigability is by far very difficult, particularly in surgical specialties, but also in medical specialties as well. Stress is at all-time high levels. You're dealing with very, very critical situations and very stressful environments. And the physical exhaustion, of course, creeps in throughout. Having a limited amount of time that you have to sleep each night, depending on how late you get home from the hospital, how many more modules and questions you have to complete, or you want to complete in preparation for the end of the month shelf examination that you have, or your standardized board examinations that may be coming up that you're preparing for. Being in high stress situations where patients are critical, you see a lot of really unfortunate situations occur to patients. Patients come in, they code. These things are very mentally and emotionally exhausting, to see poor things happen to patients that you really care about, and you want to see the best occur to them and for them. So it's very important to have really, really good coping mechanisms, ways that you can de-stress, de-fatigue, and ways that you can orient your schedule in a manner that allows you to get back the next day rejuvenated, re-energized, ready to attack the day with the energy, with enthusiasm, with happiness, and with joy, peace, gratitude. For me, it's very important every morning to wake up a couple minutes earlier, sacrifice some sleep, and just meditate and pray and be very thankful to my God and Savior for, truly opening the door for me and helping me in every step of the way. To know that even when I'm in stressful situations, even when I'm getting yelled at for doing the wrong thing, even when I don't know the answer to certain questions and I can't help people the way that I want to, that I know that, there is an answer that I can go to, more senior residents, more other attendings for help. And they're willing to help me because we're all in this together. And having good senior residents and attending is pivotal for having a good experience as a medical student and especially a resident because you have someone to rely on. I always have somebody in my contacts that I can call depending on what situation may befall me, depending on what I need help with. I have people I can call in various, different considerations and situations where I can get help in that situation. Now, the physical exhaustion, that's the hard part. Learning to take naps, particularly when I get home from the hospital for an hour, and then waking up taking care of clinical duties or modules or questions or whatever I need to do, preceded by getting a good 7 8 hours of sleep when possible. And when not possible, it's okay. Just continue to push through it, continue to work hard. Make sure you're getting exercise, which helps reverse the negative consequences and implications of sleep deprivation. So it's important to continue exercising, to continue working out, to continue trying to get sunlight and proper nutrition, all of which is very, very helpful for your own health as a medical student and resident.
Very well said. Trying your absolute best to maintain an exercise routine, sleeping when you can, utilizing your support system, all great things. And that transitions well into our next question. How did your support system, be it friends, family, you mentioned you're involved with the church, co residents, things of that nature, how did that factor into your adjustment to residency?
Yeah, great question. So I was very fortunate enough to live close to home during my residency for residency. So and during medical school, so I was always able to continue to go to church on Sundays and to go to Bible studies on Friday to continue learning and growing in the spiritual aspect of my life that was very, very important to me. It's important to consider more than just the morbidity or mortality of life. It's important for me to understand the implications, what's going deeper than the surface. How do emotions participate in the spirits and the souls of each individual more than just the bodies and the physical and the mental ailments that other people struggle? How is their spirit? How is their soul and everything like that? And how is my own soul? So going to church regularly and participating in the breaking of bread and the fellowshipping with other good friends of mine through the church was a very important aspect for me to kind of stay connected with a lot of family members and friends that also participate in that stuff, in addition to being able to talk through what I was experiencing in the hospital, what stresses I had in a de-identified situation, so I can, talk about my stresses with other people and cast my anxieties onto the Lord for knowing and remembering that He cares for me and He wants to help me. He wants to be with me through the whole situation. Every step that I take, every moment I'm away. And even when I was away from home in different areas, I would just look up local churches and go and try to attend one or two of them, seeing one that kind of meets my own morality and follows, the standards of the Bible, and continuing to plug into that and learning to grow spiritually in that regard as well.
And how would you say that that has helped you through the challenges of your first year of residency?
Yeah, it helped me a lot through the challenges of first year residency, particularly after really long shifts, after really late nights, after really critical situations and really, really sick patients where you don't see good outcomes occur because of patients' comorbidities, even though we participated and performed the best type of medical treatment and surgical treatment necessary for these patients. Sometimes they just still don't do well. And seeing that day in and day out, particularly when in the intensive care unit, or when on more critical trauma services and other morbid kind of rotations, you need someone to rely on for your own mental health and your own mental sanity. And for me, it was friends and family through the church and going there and learning to talk to people through it. It's very important to have that emotional, social structure and the support groups where you can talk to with one another, where you can learn to, you can only control what you can control, learning to give it to God and learning to kind of try to, control what you can control and accept what you can't control and try to grow and be proficient and confident in the things that you can grow and be proficient and confident in, and maximize your own knowledge and your own learning ability and your own medical acumen and everything like that, while accepting that unfortunate situations may occur, learning to learn from each of them through monthly morbidity and mortality conferences, which are mandatory that we participate in, to see why a patient can have a bad outcome. What limiting factors can we kind of instate and follow with next time to make sure things like that doesn't happen again? And really seeking to understand the reason for everything that occurs in the hospital is very important.
Absolutely. Thank you for being transparent with that. Perhaps that knowledge could support somebody who's going through a difficult time, be it in medical school or anything beyond. Thank you for sharing that. What advice would you have for a new resident, so that they may show up with confidence, but still remaining humble and teachable?
Yeah, great question. So to appear confident and then humble and teachable as well is simple. You remain kind of like a fly on the wall. You want to be silent. You want to be observant. You want to learn while looking and seeming attentive and actually being attentive. Remain plugged in. Don't play on your phone unless you're taking notes or something, but have a notepad, have a book, write some things down. And then when you get asked the question directly, answer the question. Or when it gets directed at a group and you know the answer, even if you know the answer but it's directed at someone else, if you're jumping in to answer a question over your co-resident or over a different resident or a different person, you might seem confident, but you won't be seen as humble as well. So knowing when to not speak out of place, knowing when to not speak out of turn, but also taking time with your patients and truly learning to explain things to them on average at like a fifth to an eighth grade reading level, to understand that patients might not have the same education and socioeconomic status as you. So it's important to break things down anecdotally in a way that they understand, in a way that they kind of can follow without using medical jargon and big words and terminology that they can't follow.
Looking back now, is there any mindset that helped you the most in navigating that first steep learning curve that's obviously required to be able to communicate with patients in such a manner, because you need to understand everything to the highest degree and then be able to simplify it for the layman?
Certainly, yeah. Having conversations with other co-residents and attendings and other medical professionals is vastly, vastly different than learning how to simplify and explain the simplicities of whatever complex medical diagnosis or complex surgical treatment that you're going to offer the patient. Drawing things out, writing things out, using simplified models with papers and pencils and paper clips and however it is to really break down the concept. Going through x-rays with patients, showing them what bone you're referring to, going through medical treatments, going through all of the adverse side effects without very complicated terminology, but really breaking it down. It requires a lot of patience, it requires a lot of time, and it requires a lot of practice. Fortunately, we go through standardized examinations at Michigan State University where they give us feedback and they say, oh, you're using too much medical jargon with the patients. You got to assume that they don't understand what you're saying when you use these very high grade medical nomenclature and terminology that most of the population can't understand. So it's very important to break things down to the utmost degree so that people can understand you.
So, Dr. Haddad, if there was something you could tell yourself the night before you started residency, what is one thing you would tell yourself?
Yeah, great questions. If there's something I would tell myself the night before residency, it's have a routine. Every day you get home from the hospital, have a routine to open up your laptop or your notebook, write down everything you learned, write down everything that you need to learn and study, and then go ahead and learn and study those things and take meticulous notes. Review those notes a week, a month, a couple weeks later, so that you're solidifying that information. Spaced repetition is the key to adult learning. What's the point of learning something extremely well if you forget about it a couple weeks or months later? If you have a very good organization, a very good system where you take very good meticulous notes on everything you learned, on the things that you need to improve upon, on the things that you need to learn about, and then you have something you can refer back to, and you can go, oh, I remember I need to know this, this, and this about these subjects, or about this surgical procedure, or about this. You can refer to the meticulous notes that you took, which I've been doing much more recently, and it's been very, very helpful because I know if I'm going into this surgical procedure, I can refer to these notes to see what I need to study about, what was brought up about that, I need to review for the next time. So it's very important to be very, very organized.
Be very organized, maintain a routine, and take notes on all things you don't know. Excellent. So our last question here, it's a two-pronged question. Dr. Haddad, now that you've made it through your first year, what does success look like for you moving forward, and how is your definition of a good doctor evolved since you've graduated medical school?
Yeah, great question. So, success is definitely as a like medical professional, it is treating your patients with the utmost respect, confidence, care, and evidence-based medicine and surgical treatments that you can provide for them at that moment in time. So much so that patients have the best outcomes that you can provide. Unfortunately, there are, of course, adverse effects and side effects and complications that can occur after any treatment that are sometimes unavoidable, but being able to care for patients to the best degree with your own diligence that you use to go out of your way and study and review and learn and be a constant lifelong learner, and having those patients truly understand what you're doing to them and refer other patients and other family members to you because of the deep level of trust that they have to your commitment to provide them the utmost care. That's the definition of success in the medical field. When you treat patients so much so that they're self-referring their family members and friends. It just happened yesterday in the hospital. We had a patient that requested another physician that wasn't on call because of the degree of care that that physician treated the patient's cousin. So it was very cool to see and very important to realize. You got to take time with patients. You have to talk with them. You have to break things down. You have to have great, communication skills and conversations with patients. That's very important. And the second question, Curtis?
How has your definition of a good doctor evolved since graduating medical school?
So, since graduating medical school, being a good doctor, the evolution that has kind of occurred since residency is, at first I thought a good doctor treats patients well with the most recent evidence-based medicine to provide patients with exceptional outcomes, minimal complications, minimal adverse effects, and minimal, bad things that occurs to patients. That's what I would have attributed as success. But having a surgeon, having a medical doctor, having a physician that treats patients the best without patients actually knowing it's the best, because the doctor doesn't simplify terms and the doctor doesn't sit with the patients and the doctor doesn't explain things to patients, and the patient doesn't even know that the doctor really cares about them but just thinks that they're another pathology, just another check that they're going to cash into their bank. That is not being a good doctor. Unfortunately, being a good doctor is participating and performing all of the aforementioned tasks in addition to breaking things down for patients, simplifying things, talking to family, making sure they truly seek to understand and know what's going on and what the treatments and the options are, and truly participating in the shared decision making, not the paternalistic medicine that has historically taken precedence in the hospital, with physicians telling patients you need to do this, but having the shared decision making between the patient and the doctor, talking about all complications, all different types of options, and allowing the patient to truly choose what the best option is for them and their family at that time. That's what being a good doctor is, truly considering the patient, all factors, their home life, what they want out of life, and then weighing that also with the evidence-based medicine, because a patient is not a page on the book. That's a real life human being created in the image of God, and we ought to treat them as such.
Dr. Haddad, thank you for your time today, sir. Folks, if you enjoyed this episode, leave us a review and share with your friends wherever you listen, and give us a follow at The Physician's Mind on Instagram. Thanks again, and we will see you next Monday.